Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
You've heard so much about stem cells. Are they good? Are they bad? What are we doing with them? Well, we are so fortunate to have a real knowledgeable specialist here, Burton Feinerman. Dr. Feinerman is founder of Stem Cell Genetic Med, and he is just doing great things. And I'm so glad that you took the time to come here, Dr. Feinerman. I know you have so many people that need you, but I think you almost enjoy not only being a doctor, but doing what you do because you see such fast and serious results.
Yeah. Well, it's an exciting field, and it's cutting edge. You know, I'm still a young guy. I'm only 87 years old, but if I was to just do regular office practice, family medicine, internal medicine, pediatrics, after you do that for about 62 years, it's time to, be creative and do things that no one else is doing. And some of the things that I'm doing are absolutely brand new. And, it's amazing how we've sent a man to the moon. We've created a space station. We do the most amazing things in technology. And yet, it was only 6 months ago that we discovered that the brain has a lymphatic system. Now, isn't that amazing? With all the anatomists, people who do autopsies, scientists, biotechnology, that we first learned that the brain, just like any other organ in the body, has a waste disposal system. And so with that in mind, it opens up the doors to whole new avenues. Companies have spent not millions, but billions of dollars trying to get rid of tau protein and beta amyloid from the brains of Alzheimer's patients, to get rid of alpha-synuclein and Lewy bodies from Parkinson patients, without any success. They just use their typical, here, try this pill, and they go through clinical trials at exhausting time and cost. And here we can make use of the brain's own waste disposal system. And so that's what I've been focusing on in recent times. And as I was driving over here to the radio station, the wife of a patient that I treated approximately 8 weeks ago now, he's a very super famous baseball player. He played for professional baseball for 16 years, which in itself is quite a long period for a professional player. And as far as baseball, I think he's the only person in baseball history that during a regular season game hit 6 home runs and a double in one game. And he was a catcher. Anyway, unfortunately, he developed severe dementia in his 70s, and to the point where when the first time I saw him, he was laying in bed on his side in a fetal position, all curled up, and his legs up into his chest, and his head and face down towards his chest. And he would just lie there for hours and hours, and he would have hallucinations. He would not sit. He would not get out of bed. He wouldn't walk. His speech was not clear. It was indistinct. And that was my first introduction to him. And we did a stem cell treatment on him using neural brain stem cells and various brain nerve growth factors and some other agents. And now, 8 weeks later, the only thing his wife is concerned when she called me today is he seems to have a lot of phlegm in his throat.
My goodness.
And I said, well, thank God this is all we have to talk about.
So he's standing upright, and he's eating, and he's doing everything he did before, just like that.
Oh, yeah. He sits, he watches television with his wife. He feeds himself, which he was unable to do before. He gets on the telephone and talks to his friends and relatives. And the other day, his wife was laughing that he was on the phone and he was saying to his friend on the phone, I really got to, we really have to pray to the angels for, and he mentioned her name, because all she does all day long is worry, worry, worry. And so that was
so
quite
tell the public about the stem cell treatment that you gave him. What does it do? What does it do that could cause such a remarkable recovery?
Well, there are certain areas of his brain that are damaged that affect his motor function, like, of course, sitting and walking, and speech even, and using his hands and arms to help feed himself. And those motor areas are damaged. The areas of speech were damaged also. So that's a lot of damage in a brain. And it's not just one small area like that may occur like in a stroke. And so the idea is to introduce stem cells that have the capability of repairing the damaged brain cells, but even more important, to regenerate new healthy brain cells. It was only 5 or 6 years ago that we were told that if the brain damages it, that's it. It's incapable of repairing itself, and we know that's not true at all now. And that idea or thought still persists in the minds of doctors and even some neurologists, unfortunately. But that's basically the whole idea. And then we introduce other kind of agents that are growth factors for these stem cells, so that they can be, it's not like a short-term thing. It can last for a lifetime.
Now, how quickly did you notice the difference from the day that you injected him?
With this
yes.
man? We noticed a difference in 6 weeks, which that's pretty amazing. That's
yes,
pretty
it
amazing. When people, one of the common questions that people will ask me before they get a stem cell treatment is that, how long will it take before I see improvement? And there's really no exact answer to that. I had a patient who was a very famous space scientist, and he developed rather classical, typical Parkinson, with severe shaking of his hands, tremors. His speech was also indistinct. He was not able, when he would walk with a slow, shuffling pace. And here's a brilliant man dealing with sending rockets into space, and yet his mind was not functioning properly. And now, what I'm about to tell you, I don't want to have people misinterpret it, but when I got out of the elevator on the floor that he was staying at this hospital, I was greeted by two of his brothers that had tears rolling down their eyes, and at the same time they were smiling. So that was a good sign. And when I walked into the room, the patient was sitting up in bed, not lying down. He had a big smile on his face. He started talking to me as normal as can be, and he wanted to show off, so he almost like literally jumped out of bed and started walking around, not with the slow shuffling pace, but with a normal way of walking. And his tremors had 100% disappeared. Now, mind you, this was only 3 days after. And
it's hard to tell that story with a straight face, isn't it? Even though it's true, because it seems too miraculous.
It's true, and he continued to do very well for almost a year. And unfortunately, we began to see some of his symptoms slowly reappear. And so I said, well, obviously, I think what we have to do is repeat the treatment, but even maybe double up the dose. Unfortunately, his children and his wife refused to do a repeat treatment.
Oh, you're kidding. After seeing what it was,
yeah.
And so he was just going to get worse.
Yeah, and of course, eventually he deteriorated quite a bit.
But they decided still not to come back.
Still not to. I mean, it was, and it wasn't, and money was not a problem because we were going to practically do it for next to nothing.
So what was the problem, do you think?
They just, that was just a personal thing that they didn't want to discuss.
And he didn't have the power to say, I want it?
Well, he was deteriorating, so he wasn't, his mind and his speech were not clear when he...
Oh, my goodness, that's a sad story.
Yeah, that was... his brothers were all for it, but the wife went over.
Amazing, isn't it? But just thinking about what it does. So the stem cells, these are the good stem cells that you put in, and they beat up the bad stem cells. Is that what happens? And so they they win.
Yeah, exactly. Now, we treat all kinds of diseases: ALS, Parkinson, Alzheimer's, multiple sclerosis, autism. Traumatic brain damage, cerebral palsy. But besides the neurodegenerative, we treat people with end-stage kidney disease, people that need to be put on dialysis or have been on dialysis and are living not a very pleasant life as a result of that. And then diabetes is very sensitive and effective to treat with stem cells. And
that's good news.
And in most cases, you can get a permanent result with your treatment. There are people that we haven't had much opportunity, but people with macular degeneration, the most common cause of blindness, that's something that we have to do out of the country, and we're lining up some patients now to enter. Now that's going to be an exciting new phase. And then people with genetic disorders, people with Huntington disease, people with cystic fibrosis, infants and children with Tay-Sachs. So the whole field of medicine will change in the next 10 to 20 years. And we're not going to be a pill treatment type of form of medicine. It's going to be... We're going to try to cure things rather than just try to symptomatically try to make a person more comfortable with their disease.
And it's really all in the stem cells now. These are the cells that make up their DNA. And you're going after any of them. The diseases are caused by stem cells when they aren't functioning. And now you're going to insert new, fresh stem cells. And so it makes a lot of sense. But
well, that's it, yeah. And...
I've learned a lot since I've been with you.
But, we still, in this country, meet ignorance and resistance. And sadly enough, that comes largely from the medical community who refuse to take the time to learn about it. And so, yes, we at the same time, since we live in the internet world, there are wonderful, amazing doctors out there offering these kind of treatments, especially the orthopedic doctors who probably are things like knee transplants and hip transplants will be a thing of the past. But there's also should be a word of caution, and I'll give you several illustrations of that. One was a young couple from the country Colombia, and they had a child who was 4 years old who had brain damage as a result of near drowning, and they contacted me, and they wanted to get the treatment, but they said they just couldn't afford it. And they went off to see some doctor in California who gave 3 shots in the arm and charged them $3,000. And, of course, nothing happened. The shots.
What was it? What shots? What were they doing?
It was Neupogen. Neupogen is a very common, it's been in medicine for years and years. It's used when people are on chemotherapy to increase when their white cells drop to very low numbers. You give Neupogen to boost those numbers up to normal. And Neupogen will increase the stem cells in different organs of the body, but in a very limited fashion. Anyway, of course, it didn't work. So then they went off to Panama to a rather famous clinic there, and they gave them stem cells from umbilical cord blood, but they gave it IV, which is hard to believe that they would do that, because anyone knows that you never can get through the blood-brain barrier when you administer things that way. So again, a second failure occurred now when the child was 3 years old. And finally they moved to Aventura, Florida from Colombia. And I've just very recently treated the child with stem cells, administering them by spinal tap and brain nerve growth factors. And I'm looking forward to seeing improvement with that.
Wow, that's a wonderful story. Now, so you don't know, though, how long we'll see.
This is just less than 2 weeks ago. On the other hand, there was a woman, and it was somewhat similar situation, the exact same age, a 4-year-old that near drowning, and she went to a doctor here in South Florida, again, who gave 3 shots in the arm with Neupogen. But besides the sadness that, of course, nothing happened to help the child, this doctor charged the woman $100,000.
I'm just I can't believe that. $100,000. Can't believe that, doctor.
And a parent is filled with guilt when their child has a near drowning that ends up with permanent or severe brain damage, and so she'll be coming in to see me again. And recently, actually just a few days ago, a 69-year-old male came in who had suffered a severe hemorrhagic stroke. They lived up in the northern part of New York, and were treated up there. And then subsequently, he was transferred to Mount Sinai Hospital in New York City for 3 months of rehabilitation. And about 10 months ago, he got a treatment. But again, this time the doctor took stem cells from his fat and gave it to him intravenously. And again, that is not going to do any good. He did, however, do one thing right, the doctor. He used a nasal cannula, and if you put stem cells in a nasal cannula, there are nerve endings in the distal part of the nose that, and with their axon connections to the brain, some of the stem cells may have stimulated the brain to some mild degree. But of course, the safe and effective way is by doing a lumbar spinal tap.
And so why do they not do that? Do they just not know, or they don't think, or what's the problem with that?
I think it's ignorance upon the doctor's part, really. Said, I don't see any reason. Doing a lumbar spinal tap is not that difficult. It's a relatively simple procedure. And
Well, this is an amazing thing. Maybe that needs to be an article that you write sometime in Boomer Times, because just you never know who's reading it or who knows. I would think that on the internet they should be able to get that information and not do it, but who knows?
Well, but that's how these people contact people who don't know. I think a lot of it's influenced by the fee, because some of these procedures are expensive. We've set up a finance company that so that people can get financing for 5 or even 10 years if they want to at low interest. And so But of course, money is always a situation. But people always assume, only the wealthy people get stem cells, and I mean, I would say that probably less than 10% of the people that I treat are what I would consider wealthy, and I mean, I've seen people that I know are just downright poor, but they get money from their friends, their relatives, their community organizations, their church. They set up a website and try to raise money that way.
Well, did all this, the negative part about stem cells, start with the fetuses? What do you tell us what you use so that people can understand this?
Yeah, well, embryonic stem cells are what gave, at least in the United States, a reputation that was challenged by the public because of religious, ethical, and moral reasons. But no one uses embryonic stem cells certainly in the United States, or even in countries that I've worked in, particularly like in Mexico and South America. And embryonic stem cells, if God forbid I developed a serious disease like ALS, I wouldn't hesitate to take that chance and use embryonic stem cells if I had a really horrible disease. Although there are other stem cells that we can use from your own body, from your fat, and from your bone marrow, and also from umbilical cord blood that are almost equally as good as embryonic stem cells.
Dr. Feinerman, I'm sure people are listening and saying, well, so how do I get in touch with him? Sometimes I get so interested I never give out the phone number, so I'm going to do that now. If you would like to call him, you can call him at 561-557-3358, or you can call his cell phone. May I give that out?
Oh, yeah,
please. 941-592-6613. Again, 941-592-6613. Or you can go to their website, which is stemcellgeneticmed.com. I know you remember this is Pencil Talk Radio. You're supposed to have your pencils there because we always offer so much unique information from extraordinary people, and we want you to be able to get it. Otherwise, you can always call our office, of course. But let me do this again. Dr. Burton Feinerman, Feinerman. He is the founder. Dr. Feinerman is the founder of Stem Cell Genetic Med. His cell number is 941-592-6613. And you can try his website at stemcellgeneticmed.com. Okay, well, let's continue with this. This is very interesting for people to understand it. So then it's not the embryonic. They're not using that. Right. What are they doing then? What do you do?
What is usually being done now in the United States is isolating stem cells from the patient's own fat or adipose tissue in the abdomen, and extracting out what's called mesenchymal stem cells, or we can extract the mesenchymal stem cells from the patient's own bone marrow. Mesenchymal stem cells have an amazing feature in that once it's injected into the tissue that you want to repair or regenerate, they differentiate, they turn into the cells of that tissue. So an orthopedic doctor, when he injects into the joints, those stem cells turn into cartilage and repair that joint. If you put it in the kidneys, they turn into glomeruli and tubules of the kidney cells, which is quite amazing. And so if you put it into the pancreas, they turn into pancreatic islet stem cells that produce insulin. So it's and the same thing is true even in the brain. If you put mesenchymal stem cells in the brain, they'll turn into brain tissue.
Okay, so let's take someone like Steve Jobs, for example, who had pancreatic cancer. Why couldn't that have helped him?
Well, he had cancer. That's a different story.
Okay, so all right.
So if you're going to, that's a whole different subject.
I see.
In which we usually they do sometimes a very drastic surgery called a Whipple operation and remove most of the pancreas. That's followed by intensive radiation. And so now and then chemotherapy. But what happened back, Dr. Stephen Rosenberg, going back 50 years ago, and he was chief officer of the National Cancer Institute, recommended at that time to study the genetic expression of that tumor and also to increase the power and strength of the patient's own immune system to target against the malignant cells. And as I say, it's been over 50 years ago, and it's only 5 years ago that that process has become more widely used and studied. And when someone would have surgery, let's say, as I just mentioned, let's say the pancreas with pancreatic cancer, they would take that specimen and take it to the lab, determine what the pathology was, which let's say was pancreatic cancer, and then throw it away. Instead of studying what kind of abnormal genes they saw, or you can, or on the edges or inside the tumor, you could see the T lymphocytes that are cytotoxic from the patient himself trying to attack this cancer. And to take those T lymphocyte cytotoxic cells, culture them into many millions, and then put it back into the patient. So cancer immunotherapy is beginning to become more popular among oncologists.
You certainly are I just speak so highly of you all the time. I wish I could have everybody who has the problem just go see you. But Dr. Burton Feinerman, and thank you so much for being here and sharing all your very special information. The cell number again is 941-592-6613. On the web, it's stemcellgeneticmed.com. Thank you, Dr. Feinerman.
You're welcome.